Hello friends, I am Dr. Sandeep Dattaroy, gynecologist and laparoscopic surgeon working in New Alma Hospital, Manakad and Mother Hospital in Thrissur. So today I am going to discuss about the fibroid of uterus. Fibroid of uterus is a very common condition seen in women of reproductive age. This fibroid, when it is present in a woman, it can cause a lot of medical problem like increased bleeding during menstruation, then pain during menstrual periods, and also it can cause infertility and sometimes the feeling of a big lump in the abdomen. So there are many treatment for these fibroids available. So first is medical treatment. So medical treatment is usually used to control bleeding and pain, and also sometimes to reduce the size of the uterus. So for medical treatment, we have tranexamic acid, which can be given to control the bleeding. Then you have many painkillers and antispasmodic. So this also can be given to control the pain if the patient suffers from a lot of pain during periods. So we can give this type of medicine to control pain. Then sometimes when the patient is not fit for surgery because of low hemoglobin, then in such cases we can give GnRH analog, which is a hormone. So it can shrink the size of the fibroid by 30 to 40%. But one disadvantage is that this treatment cannot be controlled for a very long time, and the fibroid can come back to its normal size after 3 to 4 months of discontinuing the treatment. Then next option is surgical treatment. So surgical treatment, again we have different types of surgeries like conservative surgery and radical surgery. So conservative surgery means removing the fibroid from the uterus. So this is usually indicated when the patient is young, when the patient has not become a mother, when the patient wants to become pregnant in future, when the patient's age is less. So in such cases where you don't want to remove the uterus, where you want to preserve the uterus, in those cases we can go for a laparoscopic myomectomy. So in this surgery, what we do is we just remove the fibroid from the uterus and then we suture the uterus back to its normal condition. So after 3 to 6 months of this surgery, patients can try to become pregnant. Then the next type of surgery is the removal of the uterus. So when the patient has severe bleeding, pain, and when she is about 40 or 45 years of age, when her family is completed, and when she doesn't want to keep the uterus, when the medical treatment doesn't help the patient. So in those patients, we can consider removal of the uterus. And this can be done by laparoscopy very safely. We have removed fibroid more than 1 kg, 2 kg in size. Big fibroids we have removed with the help of laparoscopy. Nowadays we have different types of high quality instrument, advanced instrument, which can help us to remove the uterine fibroid or the uterus without much side effects or without much complication during surgery. And we also have different types of bags. So after removing the fibroids, we can keep the fibroid in the bag and then we can take it out from the abdomen using a morcellation machine. So the fibroid surgery, whether you remove the only fibroid or you remove the uterus, it is a very safe procedure and can be done laparoscopically. In our hospital, every year we do approximately 400 laparoscopic hysterectomy, that means uterus removal, and we also do about 150 myomectomies, that is removal of only fibroid through laparoscope. And we have a very good pregnancy outcome after laparoscopic myomectomy. Every year at least 5 to 10 patients deliver in our hospital who has previously undergone laparoscopic myomectomy. So it is a very safe procedure provided it is done in a proper place by a person who is properly trained and experienced in this procedure. So if you have fibroid, please don't be afraid. Come forward with your reports and we are here to help you. Thank you.